Thank Dr. Swati for giving me the opportunity to be part of this instruction course, and we take on from what is new in neuro-ophthalmology and something that all of us should be aware of. I'm going to talk about a disease, a common condition called ischemic optic neuropathy, a condition which has been getting a lot of attention of late because there has been some work going on in this. Unfortunately, in the past there wasn't much that one could achieve in these cases. But now, with our understanding increasing, there are some breakthroughs that have happened. So, briefly, I'm going to talk about NAION, and that's the subject that I've had. So, ischemic optic neuropathy is the bigger topic, and then within that, we have non-arthritic anterior ischemic optic neuropathy, or NAION, and that's what we're going to talk about in today, an update on what's happening in that field. So NAION is a more common form of ischemic optic neuropathy. It's much more common in arthritic. So it's majority of the ischemic neuropathy is basically the non-arthritic phenomena. It presents in the 6th to 7th decade. It is because of obscuration of the short posterior ciliary arteries that happen. And the risk factors for this could be a small optic nerve head, which are the ocular risk factors or the disc crowding. Then there are systemic risk factors, which could basically range from hypertension, diabetes, collagen vascular diseases, cardiac diseases, so homocystinemia, so a lot of these coagulopathies, so anything which can lead to some kind of a vascular compromise, a blood supply compromise to the optic nerve can lead to an ischemic optic neuropathy, and this presents with a sudden painless vision loss. Typically, people describe it on waking up in the morning time because there has been some nocturnal hypotension, and this presents with a few features, typical clinical features such as an altitudinal field defect, as well as it can present with an RAPD. And you'll get to see a disc which is having a segmental kind of a disc edema that could be initially hyperemic, then going into a pallor as well. And again, it's a small, the fellow eye would have a small crowded disc that you could look at. There could be some peripapillary hemorrhages. The fields I've already discussed would have an altitudinal kind of a field defect most commonly, but you could have a generalized depression, a constriction, different kinds of field defects are possible. Color vision contrast is usually affected in these conditions. And then the risk of involvement of the other eye is about 15%, the 5-year risk of involvement. So that's why it's important for us to take care of any risk factors which are, which could be causing this, any kind of a systemic risk factor. One thing that differentiates this kind of an edema, ischemic neuropathy from optic neuritis is that the disc chromatoxia is not as severe as the case of optic neuritis. And this is happening a little bit more in the elderly people. And we're knowing that as such, there is no definitive treatment as of now. Control of risk factors, some people have tried aspirin, there is anecdotal evidence there on that front. But steroids have also been tried of late, and we'll come to some of the updates on that front. Now, this is what it looks like, the clinical picture. You can see a slightly edematous disc. The other disc is looking small at wrist. You can see slightly tortuous vessels, and there is leakage on the fundus fluorescein angiography. So what is changed? What is happening, changing what's new in the understanding of NAION in the last year or so? So one that with the use of the OCT angiography, we've seen that there is a definite difference in the perfusion in the small vessels that are present in the peripapillary area or the superficial capillary plexus there, as well as the superficial and deep capillary plexus in the macular area. So this both has been said. So we know that there is a small vessel disease that's happening. It's not really necessarily a large vessel disease up front. Apart from that, we are also realizing that one of the factors definitely we look at was inflammatory changes in ESR CRP for the arthritic eye. But now for NAION, a red cell dystrophin width is a factor which is shown to have an association in up to about 33% cases, or a strength of 33%. And again, as of now, we don't yet know the implications. This has just been coming out, and people have found that there is an association with erythropoietin levels as well in the past. But so our understanding of pathogenesis is not just a stroke, actually. There is an inflammatory component, there is a compartment syndrome that forms, and there is some edema that develops even on the macula. Now, what is happening in terms of, what is new in terms of NAION treatment? So let's look at steroids, and I think that's something that we've been discussing as well quite frequently in the past. While there is no definitive evidence to say, there's no randomized control study which is saying that steroids are the ones which go in this way, but we have found that it's definitely required for arthritic AION, but for NAION also in non-diabetics, it may be useful. And there's an randomized control trial that we had conducted with Dr. Rohit Saxena, Dr. Swati, all of us at RP Center. We found that there was a 2 or more lines in the non-diabetics compared to a placebo, and that you needed to treat 4.7 patients in order to see a visual acuity 2-line improvement in one eye. So there could be a possible role of a steroid in NAION. On the outcome, there have been various studies which have looked at steroids. as far back as the 1970s by Folds et al. And a big proponent of the steroids has been Dr. Harry, S.S. Harry et al. And his studies, including a patient choice study in the past, has found significant benefit based on steroids. So, but I'm not going to go into the details of these, but these are easily available. And you can see just by this table that how many studies have been there. And as many studies as have said that steroids are beneficial as this group, the similar number have also said it doesn't really have a benefit, and they find no benefit out of use of steroids. So therefore, this still continues to be a gray area. There have been adverse effects of steroids that have been reported in various studies, and we should be aware of that. And these include development of serious adverse effects in about 30% of the patients, and 10% would need an increase in diabetic medicine. The sugars would permanently go up. But overall, we've seen that, at 20, and different studies by our study as well, that 25% of patients on steroids developed some side effects as compared to 13% of placebos. So there is definitely an impact. So one has to be careful in how to use. And impaired glucose tolerance is one of the major things that you could see. There was a study going on recently about a small interfering RNA called QP11007. It was a novel agent that was thought to prevent cell apoptosis. Unfortunately, not too much benefit was observed in the phase 2 studies from this. A few studies have now have happened on certain other compounds as well, one of which is the ROCK inhibitors. So they've looked at that. So they've seen that these ROCK inhibitors, which have now been also being Rho kinase inhibitors, which are also being used in glaucoma practice, have reduced the retinal ganglion cell loss, by having a strong antioxidative effect as well as anti-inflammatory effect, and even they prevent the disruption of the blood-retina barrier. So they found that this could possibly reduce the amount of damage that one could see, in cases of NAION. And this is again something that has just come up last year and been published this year. So while work is going on in NAION, in terms of its pathogenesis, its treatments, we still have to make a significant headway. As of now, control of systemic risk factors, use of things like aspirin, use of giving multivitamins, the only choice that we have. Another thing I want is COVID and NAION. And this is NAION has been something that people have had raised concerns about in the last era, ever since COVID came. But one, from the vascular and thrombotic aspect, but more so from the fact that a lot of patients are put on prone positions, and it is in these proning positions that there is pressure on the eye, and there is possibly a theoretical risk of NAION. Though we haven't really come across anything other than probably one report on the same. So, but just to sensitize that NAION is something in the COVID period that people are have reported, but not so much from a prone position, which was initially theoretically thought so, more from a vascular thrombotic standpoint. So I thank you for this quick update on NAION, and happy to take any questions.